The fund that has been established by this bill, do you think it will be properly managed so that we will not have this kind of complaints?
That's a very, very good question. I think we have the capacity to manage it, but we need to work on our attitude. We have the capacity. Nigeria does not lack anything in terms of human resources, but there must be change. We must change the way, because we cannot implement the same thing over and over again expecting a different result. So I believe that if our attitude change, this is why we have a group like National Orientation Agency. Nigeria as a country, we need to go reorientation, where our attitude, people value lives, where we're able to make connection between what we do and an outcome. So if the health providers know that, and the commissioners, the minister know that what they do, the action they take impacts on the common person's life at the grassroots level, they will do that. And so it's like, how do we draw connection? How do we make that connection between what they do and what happens? Because a number of people sit in their offices not knowing that the people who are dying of cholera, women who is dying from childbirth, is as a result of their action or inaction. Because when you fail to pass a paper or a budget or release a budget or provide the services and the money has been budgeted for, then you are responsible for those things happening at the grassroots.
I asked the senator a question. I said, the bill doesn't really check the minister. I asked about the minister. But looking at the commissioners now, you said they're sitting in their offices, they don't know that they are not signing a certain document is affecting somebody in the village somewhere. Now, one would think that this bill will be really specific so that for this not done, this is a punitive measure. So that, as you said, the lives of Nigerians are saved at the end of the day. But that doesn't appear to be the case, even with this bill.
Yeah,
yet you're hopeful.
Yeah, I'm hopeful, but I don't think the bill can do everything. This is where even you, as a journalist, have a major role to play. Because we need to hold the minister accountable. I know we work at some point with a former minister where when I say we, my project, and the development partner, we work to make sure that if a minister say they're going to do X, Y, Z in 6 months, we follow through. You get the media to do some investigative journalism and follow up to say, okay, you made a promise that you're going to do X, Y, Z by so time. How far have you gone? So the journalists, the media houses should also follow through. So it's a civil society responsibility to hold government accountable. But a lot of them are not doing it. They're looking for how to sustain themselves. So I think we need to activate the social society movement to make sure they're able to hold government accountable. We need to get the traditional institution to hold government accountable because everything is politics in Nigeria. Nobody asks them what they are supposed to do. It's like what they're doing in their respective home as dividend of democracy. So I think for me, we need to put a mechanism in place that will hold the minister, the commissioners, and everybody in health accountable for their stewardship.
You're with the Partnership for Transforming Health Systems.
Yes.
So one imagines that you'd have looked at over time different policies in the health sector in this country.
Yes.
How does this health bill change anything from the previous programs, schemes that have existed in this country before today?
Number one, it provides additional funds. It's not the only fund. It provides the states opportunity to have additional funds to scale up activities, to improve the quality of care that they provide. Because when you ask states, they tell you we don't have money to do ABC. For me, I think it's unacceptable that we have even donors coming to do the little thing that should be like the responsibility of government. So this bill will provide that opportunity. It's supposed to be like a basket fund where people, like in a state, people come in to contribute to a common fund. And because you contribute to that common fund, you're able to manage that fund. So it's not just the responsibility of the state to manage it, in which case they can either mismanage it or not.
Tie it down to health insurance.
Yes.
Where is the specific? How does this, enhance health insurance scheme or something?
Well, the bill, even though I'm not sure if you ask the senator, because what is in the bill right now says not less than 1%. The initial one was 2%. So it's something that we also need to look into. But when you come to health insurance, because the bill has two parts, health insurance takes 50% of the total fund. So that's a lot of money coming to them. That's a lot of money coming to state. So the National Health Insurance Scheme, which I think you also need to bring the National Health Insurance Scheme Secretary and also the Executive Director for National Primary Health Care Agencies, because they should be able to tell the country also what this means for them, because they're going to be managing this fund. So for me, if you ask me as an individual and as somebody who works in the development sector, it should be about putting system in place now to make sure that we don't implement health the way we're currently implementing it. For national health insurance, because if we're looking at universal access to health, that is the way to go, because people cannot pay for those services today. Number of people are dying because they cannot pay for it. And we all know that about 70% of funding comes from out of pocket in Nigeria. That's a lot of money. So I believe
Does this bill take care of that aspect for you?
I think it does. It depends on how we implement it. I worry about implementation more than the money. If the money is released tomorrow, my major worry will be how do we implement it? It's specified in the bill, but the attitude, the character of the people that are going to manage it, do we have a program that will do a reorientation, a refocusing? Because this is a country where you are treated based on the way you dress, based on where you live, based on the type of car you ride. It's happening in the health sector. Health sector is not a private sector. It's not like a money-making sector. It's a place where you go and you give of yourself. It's not a place where you go to make money, because we're talking about debt here.
Dari Dada is towing the line in which you are, but he's saying the bill, ironically, took a long time, but does not address the fundamentals of the people that will implement it. Managing those people, the bill doesn't say anything about it. That's what Dari Dada is saying, and that's what you said here. Why do you think that was so?
Well, this bill took care of a number of things. If you saw the bill, the original bill, and what we have today, today's own is just like a carcass of the original bill. The original bill took care of a number of things. There have been several reviews. It's gone back and forth, debates and all that. We're also responsible for some of these things extracted from the bill. A lot of them were taken care of before. But in the process of trying to satisfy and make sure that we reach a common consensus and that this money is released so that we can have a breather and we can now hold government accountable, a number of these things were removed.
So yes, but yet you're satisfied with the bill?
Yeah, because for me, I'm satisfied with the bill because it provides opportunity for funding. Because our people, the truth of it, I work in the sector. I go to the local government area. I've been in an hospital where within 30 minutes, 5 dead bodies of women who were trying to bring another child to the world were rolled out. I was there. I'm not something that I was told. You go to a place and the same hospital in a corner, there were a heap of children that have died overnight, more than 17 of them. This is a big city. I'm not talking of a rural area. So for me, I think let's release the money. Let's implement the program. Then let's look at what are those areas that need attention, and let's pay attention to those things. But trying to make the bill work on paper before we get to the ground will not solve the problem. We need to release the bill. We need to get the president to sign the bill. We need to get the House of Rep to sign the bill. A number of questions have been asked. We've had public hearing. The House of Assembly have had that. The House of Rep, they've had that. So we expect that this bill should not take much longer. It should be passed, signed this year. And then we cannot collectively work together to address those pitfalls, those gaps that exist, because it gives us an opportunity to address those gaps, but not trying to make it work on paper. We will never get there.
Well, because this one seemed to be for those who actually need help. But one is actually wondering what happens to the practitioners. So that it doesn't seem that once this is passed into law, we'll now have some other bottlenecks or issues with the practitioners. Now, from our tweets here, some pharmacists are already saying that they should also have their own input in this. So it looks to some that look like some medical professionals haven't actually been contacted in the drafting of this particular bill.
No, I think that would be very wrong. With all due respect to my colleagues in the pharmaceutical, I'm not, I'm just strict public health person. I don't believe in this politics. For pharmacists to say they are not aware, I think it's unfair because they've been all along at the same time. We had a retreat in Obudu to bring all of this. We went through page by page. Pharmacists were there. You know, this is what I'm talking about, being centered, you know, professional centered. You want to focus on pharmacy. What they should be looking at is the provision in the bill that enables them to develop their profession. What are they doing to make sure we don't have fake drugs? What are they doing to make sure that they have their own professional practice and their people are up to date? That's what the medical profession should be doing. That's what the nursing profession should be doing. That's what the medical lab profession should be doing. Everybody should be working to make sure the client get the best, not to make sure that we occupy positions.
Let me get your quick response on this clause 46, which talks about medical treatment abroad. It says, without prejudice to the right of any Nigerian to seek medical checkup, investigation, or treatment anywhere within and outside Nigeria, no public officer of the government of the Federation or any part thereof shall be sponsored for medical checkup, investigation, or treatment abroad at public expense, except in exceptional cases on the recommendation and referral by the medical board, and which recommendation or referral shall be duly approved by the minister of the commissioner or the commissioner of health of the state, as the case may be. How do you see this playing out?
Well, as somebody who also is very, very close to information, there is a state, I just give you an example to answer your question. There is a state where the state's annual budget was spent on medical tourism, which means if the commissioner for works was sick and wanted to go for medical checkup, he goes to Ministry of Health. That money was taken from the head budget, and they were using donor money to run their program, while they were using the state budget to send public officers overseas. It happened in this country. So for me, I think this is good because, again, I go back to the governor of Lagos State who said he's improving services. At the last National Council head, he said he's improving services so that when he is sick, he will not be taken outside of the country. He will be treated by his people. I think that should be our attitude because a lot of money goes in. I was on a flight where I saw a commissioner, a former commissioner in the state.
Yeah, but do you think this will work?
It's long. I mean, going to get approval from the minister might be an overkill. Right. But I think there should be a system. Again, like I said, this is one area that we need to work to make sure how it works effectively.
Okay, Mr. Mike Egoh is a National Program Manager, Partnership for Transforming Health Systems. Thank you for coming on this morning.
Thank you.